Okay. Welcome everybody to this session of the Women in Medicine and Science in the Department of Medicine. I want to welcome everybody to this session, and we thought that we would record it because it is such an important topic. The topic for today is engaging with advocacy efforts, and we have a great panel to talk to us about these efforts. So instead of introducing every single one of our guests today, I will let them introduce themselves with the very first question about who are you and what do you do? So, Bree.
Yeah, thanks, Silk. My name is Bree Weaver. I'm an infectious diseases physician. IU School of Medicine. My clinical practice is at Eskenazi and at Riley, where I do general ID work at Eskenazi, but in both places I do care of children and adults living with HIV. So that's kind of my tie-in to advocacy, because in working with my patients, I came across individuals who were working on multiple different advocacy avenues, and that's how I jumped in. So that's me.
Great. Ellie?
Hi, everyone. My name is Ellie Hansat, and I am an epidemiologist at the Marion County Public Health Department. And I am also involved with the Indiana Public Health Association. I'm currently the past president of the association board. A lot of my advocacy efforts come in that realm and working in the professional organization space. But there are some advocacy efforts that I participate in through work as well. And we're going to get into a little bit more detail through some of the questions on what's appropriate for work versus personal time. So I'll save some of that information, but that's an overview of who I am.
Thank you, Ellie. And Haley?
Hi, I'm Haley Pritchard. I'm also an infectious diseases physician. My clinical work is primarily out of IU Health University and Methodist hospitals. I'm also on the IU School of Medicine faculty. And my connection to advocacy is I have done some advocacy work through the Infectious Diseases Society of America, which is the professional organization for ID providers. But I'm also a founding member and secretary of the Good Trouble Coalition, which is a 501c4 organization that developed and was incorporated last year to advocate for public health and health equity in Indiana.
Great, great. So I think you cover a little bit of why you do this work just based on, your responsibilities, but how do you advocate and what do you get from doing that? And I think any of you can answer unless you want me to call on somebody.
So advocacy looks very different. There are lots and lots of ways to advocate. The ways that I have advocated and am advocating are through working with my professional organization. I'm on the Antimicrobial Resistance Committee through IDSA, and through that, we organized some advocacy efforts in Washington, D.C. last October to speak with congressional staff and congressional offices regarding several really important pieces of legislature surrounding infectious diseases, public health, epidemiology, pandemic response, and essentially preparing our workforce for the next pandemic. The other way that I am advocating is through my work with the Good Trouble Coalition. I want to clarify that I am a founding member out of a group of founding members. I did not start this by myself. I am part of a large group of healthcare providers and non-healthcare providers with a stake in health equity and good healthcare, who all felt like there was not a group that we aligned with that was advocating for health issues in Indiana in the way that we would like. So we started one ourselves. And through the Good Trouble Coalition, I have helped author op-eds in newspapers, fundraise for newspaper ads surrounding the issues that we care about. We have also been able to testify during the Indiana State Legislative session that just ended surrounding several bills pertaining to healthcare and health equity.
Ellie?
I can go. I am a member of the Good Travel Group as well, and in that, I am kind of available to help with things that I can do, things that mean a lot to me, and in the end, wind up donating a lot of money to other efforts that I can't actively support in. So advocacy, like Haley said, looks different for everybody. And for me, if I'm not able to go and do something, I'm going to support them in another way. I mostly have done advocacy work with HIV laws. So the laws surrounding criminalization of people living with HIV. And I got there because I was listening to individuals I know that work in the HIV field, and they were talking about the things that were important to them, like these laws. And they were talking about how there weren't many physicians working with them, and they had a really hard time getting their point across to the legislators who were making these laws or making changes to these laws. So I listened to what they needed and just helped to be a voice of the science behind HIV care. The laws were enacted way back at the beginning of the HIV epidemic, and they have not caught up with science. They were mostly based on fear before we knew a lot. And it's been an uphill battle to educate the public and the legislators about that. So I use my expertise as a physician, but on my personal time to advocate for those efforts.
And I would say that through professional organizations, so I used to be involved with I used to work in environmental health. And so through the Indiana Environmental Health Association, that's when I started getting involved with advocacy efforts. So that group, we had a committee that would track bills through the Indiana legislative session that pertained to environmental health. And through that, we provided some education to our organization members. And we did a lot of trainings where we would arrange like trips to the state house and talk about the legislative process, which is really important in doing advocacy work that's pertaining to state or federal level legislation, is understanding how that process works. So having that base knowledge is really important. And so we had some instances where we provide testimony if needed. And some of that, so there's a fine line between advocacy and lobbying when you are working with actual bills that you are supporting or not supporting. Providing some of this work we can do on work hours when it pertains to our roles in providing education. And that I always clear with an attorney within my organization before I do anything on work hours that may come across as something that's more in the lobbying versus advocacy department. And so I started that work when I was involved with the Indiana Environmental Health Association, and then transitioned when I moved into more of a broader public health role into the Indiana Public Health Association. And through the Indiana Public Health Association, we've actually been very involved with the Governor's Public Health Commission. Our administrator sat on that commission, and so that she was the voice of the IPHA board, the IPHA membership, provided work through that, and then that transitioned into some bills that were proposed this past legislative session. And so we're involved. We hosted meetings weekly with stakeholders just to try and talk about efforts that way. And we also have hosted monthly policy and advocacy meetings for our partners and our members. And so I've been involved in that way. And so we also have a list of bills that we track that are pertaining to public health. One thing of note is that when you get involved with advocacy, either at the organization level or at a personal level, coming up with what you're most passionate about is important, because there's always going to be, especially working in public health in a state like Indiana, we're always going to have bills that we need to address in every legislative session. And coming up with what your priority areas is important, so you don't get overwhelmed, because there's going to be people doing the work, and just making sure that there are partners covering everything, but not thinking that you personally have to address every single policy and every single bill that's being addressed. So at work, we hire outside lobbyists to do our actual lobbying, but I've attended those meetings for the past 6 or 7 years, just to get an idea of what my organization is supporting and what my organization is involved with, and what our lobbyists are actually working with at the state house level. And so you can see that most of the advocacy work that I do is at the Indiana level or the Marion County level, just because that's where I work mostly. And then we do at IPHA sign on to federal level letters of support of partners who ask us to sign on to letters to support them and show support in that way. But we are less involved at the federal level, just because we are an affiliate of the American Public Health Association. So the APHA does more of the federal level advocacy work than we would at IPHA.
Ellie, let me ask one clarification point, and then I'll go for another question with the group. As it seems like this fine line, especially as we're talking about a higher education institution, especially an academic medical center that is obviously paying close attention, all of their faculty, staff and trainees, to public health issues in the state of Indiana. So is there a fine line, or is it a very easy line to see between lobbying and advocacy work?
So lobbying would be coming in and supporting or having an opinion, a strong opinion on a proposed bill or piece of legislation. I think that there's a fine line in that you could provide advocacy through education, and that education could be showing that you have the evidence base that's kind of like supporting the bill or not. But providing the education itself is not lobbying. So I think that's why it's a fine line, because as long as that's where I say clear it with your attorneys if you're going to do it on, or whoever makes those decisions within your own organization, if you're going to do any of that on work time. But like phone calls to your legislators, emails to your legislators, that should all be on your own time, interacting with people in the political sphere. Anything that would be perceived as the politics of it would be personal rather than work.
Yeah,
you could do that through your professional organization. Politics. Yeah, you can do that through your professional organization, but that's where it gets a little messy. But
okay, Bree, did you have a comment on the fine line between lobbying and
yeah, it's very short. I've been really happy with the communications I've had with the Office of Government Relations at the School of Medicine. They're willing to talk to you. They pay attention to what's going on with anything related to medicine, and they will kind of give you their clearance or blessing if you are going to speak. So I've spoken multiple times for House and Senate committees and with special study sessions, and did exactly what Ellie said, provided education. But I wanted to make sure that they knew I was doing it and they were okay with for example, there were PowerPoint slides that gave my credentials. And I said, am I able to say this? Can I say that I work for IU School of Medicine and I practice here? And they said, absolutely, that establishes your credibility. But then you also say, but I'm speaking on behalf of myself, not my employers. And it was very simple, but they were real. I was so nervous, but they were really great in making sure that that fine line was kind of, the I's were all dotted and the T's were all crossed.
So just to be clear that maybe we should reach out when we engage in some of this work with the Office of Government Relations for the university or the School of Medicine. Yeah. Okay, good. So we have talked a little bit. I think you have sprinkled again the professional versus personal time. So let me ask, how do you balance that between professional and personal, and how do you find the time? to do this work, especially if you're doing it at a personal level?
Yeah, that's always really hard. I think some of what Ellie mentioned of figuring out what you're most passionate about. We may care about lots and lots of issues, but we can't devote all of our time to every single issue. So really focusing in on where you want to spend your time, effort, and potentially money is key. I think that we all talk in academics and medicine about various types of burnout, and advocacy burnout is a thing. So we can't fix every single aspect of the world, but we can pick a couple of things that we could use our influence for.
Good, thank you.
I mean, we do a lot of things in the evening and on the weekends. You know, we do it outside of work time or during lunch. I can call my senator and things like that. We kind of work it in.
And time-wise, some things take less time than others. If you're going to go provide testimony at the State House, that's going to take more time than if you're going to make a phone call. Most of the time, your legislators aren't actually going to answer the phone. So if you leave a message, you could have something quick scripted. You could have your legislator's phone number or their legislative aide, the numbers programmed into your phone, it could take 5 minutes out of your day. Some things are very quick to do, so that the less time consuming things are make it a little bit more. And I think you had asked, there was another question in there that I was going to answer and now I forget it. So I'll wait until it comes back up.
Calling your legislators is probably one of the easiest things you can do. It doesn't, they don't want you to be on the phone for a long time. They want a quick 2-minute phone call. I am Haley Pritchard. I am a citizen of Senator XYZ's district, and I am calling today to support or oppose whatever you're calling to support or oppose. And that, the more people call, the more they take notice. And it's just something that's really fast and easy to do.
That's a great point, Haley. So, we talked, I think, again, we mentioned earlier about the different types of advocacy or methods to advocate. And obviously calling your senator or your representative is one of those. What other things are there that we can do?
Yeah. So with the caveat of being wary of everything on social media, as an example, through the Good Trouble Coalition, we will often amplify other advocacy efforts being done by other organizations. So something as simple as if there is a letter to sign on to that it will be sent to legislators or someone in a position to actually affect change that you can sign on to support or oppose something. Signing on to it and then spreading it is something that is quick and easy to do. Donating to organizations you care about is a quick and easy thing to do within reason for your own budget. Just having appropriate conversations with your colleagues and with your circle about things you care about it may have more impact than you think it does.
Don't forget to vote and encourage other people to vote. That's something as simple as that.
Yeah.
Good. So we have calling, social media, donating, conversations, and voting.
Yep.
Okay, good.
One other thing that is it's not going in front of legislative bodies and talking. Just if you can, find time to volunteer for things that are happening in your community. If it's health fair, for example, I think a lot about what's going on at Eskenazi with the health equity zones and just volunteering at a health fair or doing something like that to support the efforts that are that someone else is organizing and supporting with money, but sometimes they just need bodies there.
Fantastic. So what is the downside to participating in these efforts, right? What is the downside to calling, social media, donating, having the conversations, voting, volunteering? What's the downside? Because it doesn't sound like there's a downside right now.
I came up with a downside,
okay.
And that is when you're more involved and things happen that you are not happy with, you're more likely to be disappointed. when things happen that because you're more invested in it, right?
Yeah,
So
yeah,
the
yeah.
disappointment that comes with it, but recognizing that change is slow, policy change is slow. So especially for us in public health isn't a quick turnover. I mean, we always say in public health, it's really hard because you can't see the counterfactual. So a lot of legislators are looking at their 2 to 4 year term, and a lot of public health outcomes don't occur. Most public health outcomes aren't going to happen that quickly. And so public health initiatives are not as sexy because they aren't quick wins necessarily. So knowing that it's a long game is hard to keep in mind. So I would say the disappointment that comes is so one of the outcomes of the Governor's Public Health Commission was additional funding for local public health in Indiana. And the request that was put in for the budget, we ended up getting about half as much as was requested, which is disappointing, but also more money than public health has ever had in Indiana. So we have to kind of flip the script a little bit. Like it's still a win and we keep going. So that was what I came up with was disappointment, but flipping the script a little and seeing the positives.
Yeah. Haley, you mentioned that burnout as well of doing.
Yeah. So advocacy, just like Ellie mentioned, we're have to be in it for the long game, not the short game. There will be disappointments in the short game, and recognizing that the changes you want will take time. You are probably going to have interactions with people who do not think the way that you do, or who are actively opposed to the things that you were advocating for. And that can be very disheartening. It's unfortunate to say, but generally the louder you are, the more people are loud back at you. Particularly in a social media space, or even if you are having conversations with people in the community, and you do need a little bit of a thick skin to handle those conversations. And that's something that can contribute to burnout too. So taking time for yourself to essentially recover that strength, recover that emotional energy for the continued work is really important.
So does that align with what you would advise to learners and trainees that are interested already in this work? In terms of, let's see, you mentioned thick skin and taking time to recharge, right, your energy. What would you say to learners that want to also start this work, but also advice on how to do the work and not get to that point of burnout?
So I would strongly encourage learners to find out what they're passionate about and get involved. You don't have to wait until you're faculty to be an advocate. The good place to start for learners is through your whatever your professional organization for your field is. Almost all of them will have a student or a learner subgroup that will help learners get involved. So starting there is a great place.
Good. Bree?
I think I would give learners that advice to take care of yourself and recharge, regardless of whether or not they were going to participate in advocacy, but also finding others in your, finding a Haley Pritchard, finding somebody that you work with that can help kind of guide you through it, because you may not know what the next steps are. And then also looking at not necessarily specialty organizations, but just general medical societies in your county or state, or also have really excellent medical student or resident sections that are Haley and I had the opportunity to see some of the impact that the medical students involved with the ISMA have, and it was quite incredible. It was inspirational for us, and I just want to encourage people to do that.
Particularly for students. So it was actually amazing to see the medical student group at the ISMA annual meeting last year. They wrote a number of resolutions with some help from faculty, from more experienced physicians, but their resolutions were more successful than many of the resolutions put forward by faculty physicians. So I would definitely encourage students and residents to get involved in ISMA.
And what that results in is ISMA supporting any legislation related to those resolutions. So it does ultimately have a big impact.
Yeah, I often think about higher education and how we underestimate the power of student activism, even though it has been there throughout history, right? The power that student and trainees have to change the institution and change larger aspects of the world that we live in. My last question is related to the leadership. So so now that we have covered, again, the professional, personal, and the trainees and learners, how has the leadership supported you or have not supported you? And if they have not supported you, what would be your message to institutions or organizational leaders to consider?
I mean, I'll start. I've done a lot of talking, so I was giving it a second. Within the School of Medicine, particularly the Department of Medicine, which Bree and I are both members of. I have a hard time speaking to the other departments within the School of Medicine. They have been supportive of our advocacy efforts. I think that like Bree and Ellie said, when you're doing advocacy work, it is important to differentiate between speaking on behalf of your employer and speaking on behalf of yourself. Mm-hmm. So again, reaching out to the Office of Government Relations can be really helpful in helping you navigate that line. But the Department of Medicine has actually been very supportive of my advocacy efforts and the advocacy efforts of others within the organization. Mm-hmm. I cannot guarantee it's the same everywhere. So maintaining that distinction between your personal statements and your statements on behalf of your employer is, I think, the biggest thing to keep in mind.
Mm-hmm, mm-hmm. Yeah, and we navigate through that as well, Haley, right? Like deciding, it's a tough decision, deciding what to communicate, again, on behalf of our own interest. Mm-hmm. But as long as the values of the department align with the advocacy efforts, it's so much easier to get involved. Bree, Ellie, any comment?
All I was going to say is that I haven't really encountered leadership not supporting, but I know of individuals that I work with very closely who are dually employed with other agencies that have been discouraged from doing advocacy work because of the specific topics that they wanted to potentially participate in. And so it's out there, and it happens.
Yeah,
it's definitely. And I wonder if in public health, Ellie's got more experience with that.
I would say that I would represent work and go to our attorney. I would be supportive because it's something that our lobbyists were working on anyway. Through professional organization and individual, obviously that's a little different. I mean, there are certain policies that we have at work that pertain. It's more about the politics of it than advocacy efforts. That we have policies surrounding internally at work, and there's only one instance that I am aware of within. I've worked the health department for 13 years. One instance that I'm aware of where we were discouraged from not speaking about an issue, which that was an outlier in my experience. So I would say typically there's support, but again, I try and stay aware of what's appropriate to represent myself as a Marion County Public Health Department employee versus a private citizen or a representative of the Indiana Public Health Association.
Great. So we're here at the end of our session, and I want to ask for some concluding pearls for all of us. So Bree, I'll go to you first as that first square again.
Keep it brief. Listen to the people that you may be advocating for, if it's not for an issue that is personal to you. Listen to them, listen to what they actually need you to do, and how to go about doing that, because you may feel very very passionate about an issue, but not really listen to the people that it's affecting, and advocate in a way that winds up being harmful. I mean, that's very vague, but yeah, listen. That's my biggest advice.
Ellie?
I would say, again, learn about the process, and at what step of the process you can get involved. And we've only talked about Big P policy, Big P here. There's starting internally, even within your organization, is a way to advocate. There have been times when there's something inside my organization where I saw that there was a policy that maybe wasn't supporting best practices for public health even, and advocating within your own organization to try and change the little p policy. And that's a way of starting out too, where maybe it's lower stake, maybe it's not lower stakes because it's within your own organization, but maybe it's at the smaller level that it might be less daunting, but just learning about the processes. And I remember the question that I didn't answer before, which was something about why it's important to you. And for me, public health, you have to be an advocate, or public health isn't going to, until this year, we were one of the worst funded states in public health. And Indiana is my home state. And it's a catch-22 working in public health here in Indiana. It's that we have so much need, but it's so hard to work here in public health. And so just for me, I wouldn't be able to work in public health and not advocate for good evidence-based public health practices. I can't separate the two in my mind. So
Good. Haley, concluding.
I'll try to be brief. So nothing happens alone. Nothing happens in a vacuum. The first step can be just finding people who also care about the things you care about and starting on the road together from there.
Good. So listen, learn, and find your peeps. Find your people. Okay. Well, I want to thank you all three for joining and hosting this panel. It was really a pleasure to hear about these topics. And is it fair to say that anybody that is actually listening or viewing this recording, that they can contact you guys to chat a little bit more if they have questions about advocacy or how to get involved, and even getting involved with Good Trouble and others?
Yeah, absolutely.
Okay,
Definitely.
great. Well, thank you very much. Here, I'm gonna stop my recording if I find it.